Croeso I Bwrdd Iechyd Prifysgol Aneurin Bevan. Good afternoon, everybody, and thank you for attending this special meeting of the Health Board. We have a number of apologies. Emrys Elias, Richard Clark, Geraint Evans, Nicola Prigodic, and Peter Carr and Keith Sutcliffe. Are there any others, Richard?
I haven't been informed of any, Chair.
Right, thank you. In attendance, I'd like to welcome Richard Harris from Audit Wales and James Quance from Internal Audit. And I'd like to bring to our attention that this will be Chris's last meeting of the Health Board as our Special Advisor Finance. We will really miss his contribution to our discussions and his vast experience. And we wish him every success for the future, and we'd like him to keep in touch, please. So thank you for all the hard work that you've undertaken on our behalf. Many thanks, Chris.
Okay, thank you, Anne. Thank you for that.
Thank you. Okay, the purpose of today's board is to approve the annual report and accounts. Some amendments were agreed at Audit, Finance and Risk Committee yesterday. And we shall go through those shortly. But once agreed, the annual report and accounts are due to be sent to the Welsh Government by Friday, the 11th of June. As Chair of Audit, Shelley, do you wish to add anything before we ask Glyn to take us briefly through the accounts? I know they've been trawled over a lot by the Audit Committee, and thank you very much for your hard work on that committee and the diligence that you've shown in making sure this was correct. Shelley?
Yes, thanks for that. I'm pleased to confirm that, as you've mentioned, Dan, the Audit, Finance and Risk Committee actually met on two occasions, 18th of May and yesterday, 8th of June, to consider the draft accounts, the performance and accountability report, which on this occasion now includes the annual governance statement, remuneration and the staff report, and that the documentation has been scrutinised and that the committee is content to recommend to the board the approval and adoption of the documents. And if I could just also add the committee's thanks to all those involved in the production of these documents, and in particular the committee members and our special advisor Chris, Wales Audit, Internal Audit, the Finance Department and the Corporate Services team. Thank you. Thank you very much, Shelley. And to reiterate your thanks, there's a huge amount of work to clear these accounts and ensure they were right. And thank you all, both the officials and the committee, in the huge amount of work that you did to be able to provide us with an accurate report, and also to Audit Wales and Internal Audit for their guidance, which has been invaluable. So thank you. Glyn, do you want to present, please?
Thank you, Chair. And I think, again, this year it's a real pleasure to be able to present the Health Board's accounts for approval by the board today, covering the financial year 2020-21. There's only a few things that I would like to say, because I think, as you rightly said, the Finance Audit Risk Committee went through the annual accounts and other statements in quite a lot of detail. So I just really wanted to take this opportunity to highlight to the board that, again, the Health Board, in reporting its accounts, will have achieved all of its key financial targets, and that includes the key financial statutory duties around essentially breaking even over a 3-year period against both its revenue and capital budget. So I think when you think about the financial year that we've just been through, the context of a COVID-19 pandemic, opening the Grange University Hospital early and within budget, and everything else that goes on in a normal year for a health board and the NHS, I think this is a tremendous achievement. And I mean, I always say, but I think it's important to repeat this, that actually delivering high quality care caring for our patients, but doing it within the resources that are available to us is very much down to everybody in the organisation and our partners. I just get the nice task at the end of the year, really, to actually present the accounts and the results, really. But it is very much a collective effort that enables us to be able to achieve this, really. The one note that I did just want to raise, which is in the accounts, is around a note on what's called scheme pays, or pension tax arrangements for some of our consultant staff. You'll find that it is just referenced as a note to the accounts this year, and that is something that is likely to be ongoing as an issue for the next couple of years, and it's something that will be referenced in the report that I know Audit Wales will want to cover in a minute. But I just thought I wanted to draw attention to board members of that particular note. It's also pleasing that Audit Wales are proposing an unqualified opinion. So unqualified means it's a good opinion. So again, that's really good news. And again, I think reflective of all the hard work that has gone into producing the accounts, but actually delivering the performance during the course of the year. And then if I can sort of finally just say a few thank yous myself, because this is very much a collective effort. I would like to thank Audit Wales colleagues and internal audit colleagues, because I know that we've had to work remotely this year and last year. And this was probably, a real test for people in terms of being able to do quite a lot of detailed audit work remotely. And I think the success of it is very much down to developing and maintaining really good working relationships. And I'm very grateful to our Audit Wales colleagues and internal audit colleagues in the way that they've approached all of this in a very constructive way. I would also like to thank the Finance Audit and Risk Committee members, because I think their ongoing challenge and support is always really, really important, not just around scrutinising the accounts, but also making sure that our systems and controls, the way that we do things as an organisation, are appropriate. And again, I think the way in which they've conducted themselves as a committee and as individual members during the last year, again, has been really, really helpful and supportive during what's been an unprecedented year. I think we've used that word a lot of times, but actually it's probably appropriate in this case. So that's all I really wanted to say. Once we've received the audit opinion, and I know Richard will probably want to say a few words in a minute, we will then be asking the board to formally approve the accounts for last financial year, and then they'll be submitted to Welsh Government by Friday. So thank you very much.
Thank you very much, Glyn, and we're all pleased to reiterate your statement about the tremendous achievement this is to break even by everybody within the organisation and to have such a good set of results, which makes a huge difference to the way in which we can operate on behalf of our patients and staff. Does anybody wish to ask any questions or have any queries to Glyn? If not, Audit Wales, Richard?
Thank you, Chair. I suppose just building on what Glyn and Shelley have said, really, I think we did have a good airing at the Audit Committee yesterday and the previous Audit Committee. That's really useful to us as the external auditors working through the accounts and flagging up the questions and concerns us and the committee members and them getting addressed through the audit is really useful to us. I don't intend to go through the report, Chair. I did that yesterday. I think just echoing some of the comments, it is an unqualified opinion. It's excellent news given the year I think everybody's had and the pressures on all the staff from all sides. It's really good to be in that place. I said yesterday, the quality of the accounts we had for audit and the drafting were really high again this year. Again, can't underestimate the task that goes into producing those accounts. And again, it's pleasing to see that improvement hasn't dipped over this way of working. we spent a bit of time on the back of last year's audit and trying to unpick how we can do things differently, how we can learn some lessons with officers. That was a really useful exercise, and we'll continue to do that because the environment has changed, the ways of working have now changed. It's where we take it. There's probably a challenge and a bit of process we need to work through. But the accounts were good. The process was really strong this year in producing and auditing the accounts. Some of the queries we had in the past, things like the REM report, they've improved massively. So some of the concerns we flagged to this forum have gone away. We have got an emphasis on matter paragraph in our opinion, which isn't a qualification, but just flags up what Glyn said about the clinicians' tax liabilities and the ministerial direction. We put a substantive report on that in our opinion as well this year to set out what that's about, because that is something that's probably going to be with us for a while. We'll need to keep working with yourselves and other bodies to see where that takes us. It is the standard set of words in your accounts, but also all the health boards and in the Welsh Governments in the autumn when we do that audit. So you're not alone in that. It's sort of been done to you. We're just trying to see how we then take that forward in future years as things might materialise. So they're the only points I'd like to raise. I would like to thank the Glyn, to Mark, to Richard and Estelle and the team for the work they've done with us through the period. It's been fantastic. I think this way of working only works when you've got those relationships. You know, the IT and the infrastructure is important, but having that ongoing challenge, discussion and opportunity to work with each other, I think has really got us to this point where it's a really positive end of audit. And like Glyn said, it's a pleasure coming to this forum and giving you that news as the external auditor chair. Happy to take any questions, but I was going to stop there if that's okay. Thank you, Richard. And thank you and your team for the huge amount of support that you've provided to us. We know it's Gabby's last week with us, I think. It is, unfortunately, yes. So we wish her every success and thank you very much for all the work that you as a collective have undertaken for us. Are there any questions to Richard? If not, no. Now, Richard Howells has got a few amendments to the report before we move to adopt them.
Yes, Chair. Following yesterday's meeting at the Audit, Finance and Risk Committee, we agreed a few amendments, and since then as well, we've identified a couple of formatting issues, so we've amended those as well. Just to quickly go through them. We've changed the Mental Health Act monitoring committee, the diagram, which reflects that it was stood down during the pandemic before being stood back up. Within the partnership working section, we've checked the manual of accounts in terms of the template, but we've also agreed that we are actually going to add some additional information in there to reflect the extent of our partnership working over the past year. Unfortunately, that will be available by the end of today. So if it's agreeable, we'll have the chair and to sign that off to actually go into the report and obviously the Judith as well. Some of the duplicate pages have been removed. And we've created a link to the audit opinion as it was originally in an embedded document, so that would be better, so everybody can actually see it. When it's embedded, it's not available. Some of the formatting, like I said, has been changed, and just the notes are on note 34 towards the end. And it's a short narrative in terms of reading. £735 has been included in employers' costs when it should actually read excluded. So we've changed that as well, but it doesn't impact on any of the outcomes. That's it in terms of the amendments. And again, I think from my personal perspective, I'd like to reiterate all the thanks to all the contributors to the report. It is hard work to actually provide it and set it all up. And also, again, Richard, if you can convey my thanks to Gabby. It's been important and it's been really useful for me to actually have the discussions I have with her regularly, and also to internal audit as well. I find them invaluable, and thank you very much. Thank you, Richard. Paul?
I think as part of our role, of course, is to be assured about what's going on within the organisation. And Aneurin Bevan University Health Board has a significant budget on behalf of the local population and is a major employer. And I think that to get to the stage where we've got an unqualified opinion with regard to the audit, I think is a tremendous achievement on behalf of all this happened, particularly with in the middle of a pandemic and opening a hospital. I think this has been said earlier, and supporting other big developments as well. So I have no hesitation at all in supporting the recommendation for this to go forward. It has gone through, and I sat in the meeting yesterday. There's a considerable discussion to get to this point, which evidences that everything's been looked at thoroughly. We've had external views on this from Audit Wales. We've had conversations with internal audit, and all that's been put together in a comprehensive report. And I pay tribute to the Audit Committee for the work they've done, and I have no hesitation whatsoever in supporting the recommendation to move this forward. And I think it's a great achievement, and I put forward my thanks to all involved in getting to this point, because I think it's just remarkable that we're there, and I'm glad that we are, and I'm delighted for all the people who've been involved to get us to this point.
Thank you, Paul. Are there any further comments? So with the amendments and with your approval that Judith and I sign off the additional paragraph on partnership working, which was discussed at the Audit Committee yesterday, are you happy to approve the accounts for submission to Welsh Government at the end of the week?
Yes.
Yeah. Yes. Thank you. Thank you very much for that. And thank you once again for everybody's really hard work and diligence in producing this, but mainly for having such a superb performance in such a very, very difficult year. Is there any other business? No? Then I declare this meeting closed, and we submit the accounts as agreed. And thank you very much. Thank you.
Thank you.
Thank you. Thank you.
Thanks, everyone.